Hi, I'm Dr. Ali. I work in family medicine or general practice, and today I want to walk you through what really happens before diabetes. Because by the time blood sugar looks abnormal, the underlying physiology has often been shifting quietly for years. My dad used to say, if the car engine light comes on, the problem didn't start that morning. That's exactly how this works. So let's start where I start in clinic, not with diagnosis, but with trends. When I open someone's blood results, the first thing I look at isn't whether the HbA1c is high, it's whether it's rising. You might still be within the normal range, not labeled pre-diabetic, reassured that everything is fine, but your HbA1c has moved from 34 to 37 to 40 over a few years. That's not random. That's a drift. Single results don't tell the story, but trends do. Large longitudinal studies like the Whitehall 2 cohort have shown glucose levels rise gradually years before type 2 diabetes is formally diagnosed. And this is where the story becomes interesting. Because if glucose is still normal, something else must be keeping it there. And that something else is insulin. You see, before blood sugar rises, insulin rises. Insulin is the hormone that moves sugar into cells. When your body becomes resistant to insulin, your pancreas compensates by producing more of it. So for years, your glucose can look perfectly fine because insulin is working overtime behind the scenes. Research published in journals like Diabetes Care shows hyperinsulinemia, which is high levels of insulin in the blood, can precede abnormal glucose by many years. I sometimes explain this to my patients. Look, your pancreas is whispering louder and louder to keep things under control. Eventually, it gets tired. And when that compensation starts to struggle, that's when glucose begins to rise. But before that happens, your body often gives subtle clues. And one of the most common clues people notice isn't on a blood test at all. It's how they feel after eating. There's something I hear in the clinic all the time. Doctor, I get really tired after lunch. Or I need sugar or coffee by 3 p.m. Or that my energy just drops. When insulin spikes after a meal, blood sugar can fall relatively quickly afterwards. Now that drop feels like fatigue, brain fog, irritability, cravings. It's not laziness, it's physiology. And over time, repeated insulin spikes don't just affect energy, they affect fat storage, which brings us to the next early shift I often see. If your overall weight hasn't changed much, but if your BMI is still normal, waist size often increases first. Insulin promotes fat storage, especially around the abdomen, and visceral fat, which is the fat around your internal organs, such as the kidney or the liver. This isn't passive, it's metabolically active. It releases inflammatory signals. It worsens insulin resistance. Now, the Lancet Commission, which is a journal on obesity, highlights how central fat strongly correlates with metabolic dysfunction, even in people who appear to be slim. I've had slim patients say, but I'm not overweight. And they're right. But metabolically, the strain is building internally. And when visceral fat, which is the fat around the internal organs, especially the kidneys and the liver, which is where we often see the next change. Before glucose changes, lipids often do. Triglycerides start creeping upwards. HDL slowly falls down, even if total cholesterol looks fine. Insulin resistance alters how the liver handles the fat. It increases the VLDL production, triglycerides rise, and HDL, the good cholesterol, drops. This pattern is well described in metabolic syndrome research. And sometimes, even before triglycerides rise significantly, the liver itself shows signs of stress, which brings us to something increasingly common in primary care: non-alcoholic fatty liver disease, which is strongly linked to insulin resistance. Often I'll see slightly elevated ALT, which is part of the liver blood test, or an incidental ultrasound finding of fatty liver, or even a patient who feels completely fine. Research in journals like the Hepatology Journal shows fatty liver is both a marker and a driver of metabolic dysfunction. And here's what's important. By this stage, glucose may still be normal, but the metabolic system is clearly under pressure. And this pressure doesn't just stay in the liver, it begins to affect blood vessels. Insulin doesn't just regulate blood sugar, it influences kidney sodium retention, the sympathetic nervous system activity, which is the body's fight or flight response system, your vascular tone, which is how tight or loose your blood vessels are. Chronically elevated insulin can gradually rise the blood pressure. So sometimes hypertension appears before diabetes. The American Heart Association recognizes insulin resistance as a contributor to hypertension development. And when I see slightly elevated blood pressure, rising triglycerides, increasing waist circumference, I don't see separate problems. I see one pattern. But metabolism isn't influenced by food alone. There are other silent amplifiers. Two of the biggest are sleep and stress. Even 1 week of restricted sleep has been shown in controlled studies to impair insulin sensitivity. Chronic short sleep raises cortisol, increases hormones, the hunger hormone especially, worsens glucose tolerance. In clinic, when I ask patients how much they sleep, the answer is often 5 to 6 hours. Sleep deprivation quietly accelerates insulin resistance, and stress just compounds that effect. Patients often tell me, but I don't feel stress. Stress doesn't always feel dramatic. It can be long hours, carrying responsibilities, emotional strain, chronic low level pressure, cortisol increases, glucose production from the liver. The American Diabetes Association acknowledges stress hormones significantly affect glycemic regulation. Your body doesn't separate emotional stress from physical stress. And over time, chronic stress, regardless of the type, contributes to the same insulin resistance pathway, which brings us to something protective, something that can shift this entire trajectory. Muscle is your largest glucose absorbing organ. The more muscle you have, the more efficiently your body handles glucose. Resistance training improves insulin sensitivity even without significant weight loss. How cool is that? Research in the Journal of Clinical Endocrinology and Metabolism supports this consistently. When patients begin strength training, I often see improved triglycerides, better HbA1c trends, reduced waist size. Most muscle acts as metabolic insurance. And this is why this early stage is so important for us to recognize and to reverse. This stage is often labeled prediabetes, insulin resistance, or even metabolic syndrome. But labels aren't the key point. The key point is this: the process has started, but it is still reversible. And this is where lifestyle shifts are most powerful. Not extreme dieting, not punishment, but consistent recalibration. Because by the time diabetes is diagnosed, the body has usually been compensating for years. The longer blood sugar remains elevated, the greater the cumulative strain on your blood vessels, on the kidneys, on the nerves, and the heart. So the UK prospective diabetes study showed complication risk relates strongly to the duration of high blood sugar levels, which is also known as hyperglycemia duration. That's why I focus on trends, not to scare patients, but to give them leverage early. And the good news, the same physiology that drives this process can also reverse it. From what I see in practice, the biggest improvements come from building muscle mass, increasing daily movement, improving sleep consistency, reducing ultra processed foods, increasing protein and fiber, spacing your meals, and managing stress intentionally. Small changes, which are repeated consistently, they matter. My mom used to say, little things done daily become big things over time. And this is exactly that. And this is metabolic health. If your blood tests are technically normal, but trending upwards, start paying attention. Not with fear, but with awareness. Because diabetes doesn't start when the numbers turn red. It starts and quietly is where prevention works the best. If you found this helpful, do subscribe. I share simple evidence based insights about early detection and long term health from the perspective of a doctor in family medicine or general practice who sees this stage every single day. And the earlier we spot a pattern, the easier it is to change the direction. Bye.